Hi, I'm Dr. Syed Alam. I am the Associate Program Director of the Crestwood Residency program here in Huntsville, Alabama. I want to share not only what makes a program unique, but also why Huntsville is such a wonderful place to live and train. At Crestwood, we offer a training experience that is both rigorous and personal. Of course, you will get exposed to a wide variety of patients and conditions, and you will develop the skills, the confidence, and the professionalism needed to thrive in your career. But what makes us truly special is that sense of community. You are never just another resident here. You are known, you're supported, and you're mentored. And that is what makes us great.
I was Rodney Holliday, and I became the program director here in April of 2024. So I'm the full-time program director for the internal medicine residency program. It's been an amazing process to watch these residents grow and mature, both academically and professionally. I call them my children, even though they're young adults, because I'm much older than they are. But it's been a learning process for both myself and the residents. Since it's been a new startup program, we've essentially learned together and grown up together in this program. To me, the cornerstone of our program consists of four things. One is education. Next is patient care. Next is research. Next is professionalism. So we try to address all those issues. And I try to convey to the residents that professionalism issues are just as important as academic issues.
We were fortunate enough that in Crestwood Medical Center, we were exposed to open ICU and then later closed ICU setting. Combined with my background in emergency medicine and point of care ultrasound, I've had the privilege of managing critically ill patients. Point of care ultrasound has been particularly valuable in enhancing my diagnostic and procedural skills. This environment has not only deepened my understanding of complex patient care, but also fostered collaboration with multiple disciplinary teams, refining my decision-making and leadership abilities.
So I think the most valuable part of residency has been the transition from a medical student to a physician. And especially over the past year, since my first year, I've grown not only in my knowledge and clinical skills, but also in identifying my professional status.
Our goal is to help bridge the gap between clinical training and academic growth, ensuring our residents not only meet graduation requirements, but they also thrive as lifelong learners, educators, and leaders in medicine. I work closely with our program leadership to design didactics that are meaningful, evidence-based, and tailored to our residents' evolving needs, from board prep to bedside skills.
I was really drawn to Crestwood because of our program director who started the program and his philosophy and outlook for the program as a whole in the future. The thing that really stood out to me was their focus on resident wellness and the work-life balance. That was very important to me in my search.
So one of the things here at Crestwood that we have is we have a really strong sense of community. And what that community means is that we have this, this feeling and this, of belonging and commitment to each other, and that we have importance not only to each other, but to the group.
I think as we progressed through residency, I realized there is a lot more of independence that I could see. And initially when I joined in, there was a close observation. I was being followed with procedures, with EMR and everything. But now I realize how quickly that transition has happened, and I'm able to, take medical decisions for my patients.
So the most valuable part has been the hands-on clinical experience, along with the good mentorship that we have here, and also along with that, having the chance to manage patient with increasing autonomy, but also with support whenever we need it. And it has helped me grow both in decision making and also has boosted my confidence. So the environment here is collegial, supportive, and growth oriented. Attendings are very approachable and residents collaborate well, and there is always a culture of teaching on the go.
So I would recommend the internal medicine residency just because it feels like a family. Honestly, it's not toxic, opportunities to learn, great patient panels, just great relationships with all the staff, and just enjoyable place to work. So Huntsville has this great feel where it's small town, but it has big city opportunities. The people are really nice, food is great, and it seems like there's always things to do.
I think it's less of a hierarchy here. I would rather say it's a big Crestwood family. So I think the population is very diverse. You have a wide range of pathology here. The attendings are very nice and seasoned. So I think all of those things make Crestwood a great program to train.
Our residency program offers strong clinical training with a supportive resident-centered environment. We focus on teaching, mentorship, and hands-on experience so that every resident graduates feeling confident and well prepared for their future.
So outside of work, we try to balance fitness and fun, hiking nearby trails, running 5Ks on some weekends, and doing some teamwork like even tackling an escape room, because apparently 80 hours a week of medicine isn't enough puzzles. But my favorite part is sharing food and getting to learn about each other's cultures.
Yes, so the relationship between residents and faculty is very integral to the success of a residency program. And I believe Crestwood is a very good example, because I've always felt that the attendings and faculty members are very approachable, which is very important.
Crestwood seems a very good place for a family, because it's very family oriented. Also, there is low cost of living here, and also the housing market is very affordable. I have 3 kids actually, and all the schools here is rated 9s and 10s, and so it's one of the best school systems in the country.
I chose Crestwood Medical Center because it provided me with everything that I was looking for, which includes a strong teaching commitment, a meaningful resident autonomy, and a peaceful environment where I can enjoy or have my a good work-life balance. Another factor that made me choose Crestwood Medical Center is that this program commitment for serving the underserved in this community, which strongly resonates with my values and my future goals.
It's a vibrant city of growing cultures and incredible food and plenty of opportunities for recreation. But once again, what I think really stands out is the balance. It's big enough to be exciting, but small enough that you feel connected. And this is a community where people will know you, and that is what makes training here feels like home. So we are excited to meet the next class of residents, and we look forward to having you becoming a part of our Crestwood family.